A major milestone today for Medicaid expansion in North Carolina. 500,000 people who didn't have health care coverage before are now enrolled. A celebration today honored the advocates who helped make that happen, sometimes in the middle of their own pain and their own loss. WRAL Capitol Bureau Chief Laura Leslie has one mother's story.
For Robin Jordan, today's milestone celebration was especially poignant. She couldn't help but think about her daughter Jessica and what might have been if Medicaid expansion had come sooner. Robin Jordan's daughter Jessica struggled for years with addiction and mental health problems. She had no insurance.
She didn't qualify for Medicaid. She was too sick to work, and she fell into the coverage gap because she was considered a healthy adult in her 30s, but she was far from healthy.
Jessica died of an accidental overdose, fentanyl, at just 32 years old. Robin, who's a public health nurse, believes that if her daughter could have had access to Medicaid, she could have gotten the life-saving care she truly wanted.
She couldn't put two nickels together to help herself to get into, a recovery center, to get help for her mental illness, for her dual addictions. But she would write in her journal about how she wanted to save money, and when she saved X amount of money, she was going to start making phone calls to X, Y, and Z places.
After Jessica died, Robin learned about the push for Medicaid expansion. She became an advocate for it, telling her daughter's story all across the state. Governor Roy Cooper singled her out for thanks at a ceremony Friday, celebrating the enrollment of 500,000 people in just the first few months of expansion.
Even though my Jessica's not here any longer to speak for herself, there are 500,000 other Jessicas today that have insurance and have hope for their health and hope for their futures, and I'm very proud to be a part of this.
Jessica would have been proud, too. Laura Leslie, WRAL News, Raleigh.